Hello.
Yeah.
All right. Sorry about that. I don't know what happened. Hello, everyone. This is Sandy Marrero with Western Marketing. I'm going to do an introduction to Mr. Seth Groth, National Director, Sales Director from Surebridge, which is going to be the one who is going to be doing our wonderful webinar today. Thank you, everyone, for joining us and for taking time today to participate of this webinar. Um, Seth, whenever you're ready.
All right. Well, I'll go ahead and get started and want to thank everyone for jumping on today's call. Hopefully you had a successful AEP and now you're kind of looking at 2023 and getting back into the sales mode. The great thing about ancillary products is you can sell them to your clients year round. And so I always say first quarter is a great time to maybe follow up with your clients that you didn't enroll in ancillary products, or even if you're working with new clients, it's a good time to talk to them about ancillary products. So today we're going to talk about 3 tips to offering ancillary products to your senior clients. But the good news is that these products are going to be available for your under 65 clients as well. And so whether you're, primarily focused in the under 65 or over 65 market, you're going to get some ideas today that you can go out and use immediately. When you contract with Surebridge or the Chesapeake Life Insurance Company, you get access to all of these products. I'm going to talk about 2 of them today. I'm going to be talking about our HospitalWise plan and our critical illness plan. But I just like to point out that you do get access to all these plans when you contract with us. Behind these products, you're going to see a couple of things. Number one is GI. GI stands for guaranteed issue, and that means that there's a guaranteed issue benefit available with that plan. And if you look up there, that means that all of our ancillary health products have at least some guaranteed issue benefit available. Might not be available for all issue ages, but it's going to have something available. Also the O65. So if it has an O65, that means it's available in the over 65 market. All these products are available in the under 65 market. So if it says O65, that means it's available for your senior clients as well. The ones that I have highlighted there, Accident Companion, Prime DVH, Critical Illness, and HospitalWise, they're our top 4 selling. And as I mentioned today, we're going to take a look at selling CI-wise and HospitalWise in the senior market. And so when we talk about over 65 opportunities, I always ask agents, what are you primarily selling? If you're enrolling your clients in Part A, Part B, and selling like a med sup, like a Part G, usually your best fit with Surebridge is going to be like our standalone dental, the PPO dental, our Prime DVH, which is a dental vision hearing combo product, or a standalone vision plan. If you're selling Med Advantage plans, typically the best fit for you is going to be our hospital indemnity plan, which is called HospitalWise, and possibly our critical illness plan as well. And so really that's where we're going to focus today, is kind of on the right hand side there. We have some new enhancements to our HospitalWise that really took off on fourth quarter, and I wanted to share those with you today. So HospitalWise, it's a great product, again, for those Medicare Advantage clients. If you go out and you Google, healthcare cost crisis, you're going to get a lot of results from Google. And so there's a lot of people out there that are concerned with the rising care of out-of-pocket costs. And Medicare Advantage enrollees, they're not exempt from that. The average maximum out of pocket in 2022 is over $5,000 for in-network, and almost $9,000 for out-of-network. And so, it's important to make sure that the client knows that those out-of-pocket costs are there with their Medicare Advantage plans. And also, you need to be having a conversation with them about how they're going to pay for it. Because I think one of the problems with a lot of senior agents is all they do is focus on the premium, and they don't have that conversation about the cost of care. And if you start having that conversation about cost of care, then it's going to likely lead to an ancillary sell, and in this case, hopefully Surebridge's HospitalWise plan. But up on the screen here is the concept that we're talking about. Right on the left hand side, It's a standard Medicare Advantage plan that outlines the out-of-pocket costs associated with that, right? Those are going to be the common copays: a copay for hospitalization, a copay for outpatient surgery, a copay for emergency care, ambulance services, skilled nursing confinement, and major diagnostic exams. So we can come out and sell a hospital indemnity plan and really dial that in to align with those copays. And in this example, we actually were able to do that with just a little over $50 a month. And so you can come in and see we did a HospitalWise plan, 6-day benefit, $300 a day. Outpatient surgery rider covered that. Emergency care rider covered that. Ambulance rider. We did a little bit less than what the copay was, and I'll talk about that in a slide here in a little bit. Skilled nursing rider, we covered that for days 21 through 100, and then major diagnostic exam. So now we're eliminating a lot of that exposure associated with that Medicare Advantage plan. And so when we start talking about the cost of care and how they're going to pay for it, basically they have two options, right? They can pay for it out of pocket, or they can look at an ancillary product like a hospital indemnity plan, and that's the concept that we're showing to them. Now, the nuts and bolts of our hospital indemnity plan: issue ages 0 to 90. So again, it's great if you're working in that under 65 market, but it's also great in that over 65 market. Underwriting, we actually have guaranteed issue thresholds for all issue ages. Yep, that's right. On the next slide, I'll show you what those guaranteed issue thresholds are. But as long as you stay under those thresholds, there will not be any health questions on the application. And again, that's for all issue ages 0 to 90. If you go above the thresholds, it goes into what we call true, accept, reject underwriting, or basically it's underwritten based on the questions on the application. There's never an MIB, there's never a script check, there's never a phone interview. So if you go above the threshold, you just have to answer the questions truthfully and favorably, and then that's going to get issued. Rate structure: there's an individual, there's individual and spouse, there's individual and children, and there's a family. And so you do get a little bit of a price break if you do like an individual and spouse or a family, because we do have an actual family rate. So you get the same rate whether you have one child or 5 child. So pretty good deal there if you are working with a family with multiple kids in the under 65 market. But even in the over 65 market, if you do the individual and spouse, you're going to get a little bit of a discount versus writing 2 individual plans. Pre-existing conditions, 6-month look back for the first 6 months of the plan. That is going to be for both guaranteed issue benefits and also for the simplified issue benefits. So 6-month look back for the first 6 months of the plan. Other than the pre-ex, there's no waiting period, so they're covered immediately for accident. They're actually covered immediately for health, assuming that there's no pre-existing conditions with them. And there is a one-time application fee of $20. Most of our products do have that $20 app fee, but if you're enrolling multiple people, it's only one app, or if you're enrolling multiple products, it's only one app fee. So just be advised that that would be applied to the first month's premium. Up on the screen here are going to be what the guaranteed issue thresholds are. This was the new enhancement that we launched in September, and it led to significant growth, especially in that over 65 market. When we talk about, whether you talk about, AEP, enrolling your clients in senior products during the annual enrollment period, or if you're talking about in the under 65 market enrolling in ACA plans during OEP, there's no health questions to qualify for that core medical plan. So it's kind of clunky when all of a sudden well, now you got to apply for this hospital indemnity plan and you're going to have to answer a bunch of health questions. And so we recognize that fact, and we wanted to offer a plan in both of those markets, so issue ages 0 to 90, and have it so that there's guaranteed issue benefits available. And that way, if you stay under these thresholds, there's no questions on the application, so it's quick and easy. And you can see they're pretty good, especially if you align them with Medicare Advantage plans. It's going to cover most of the copays, right? And so some of them might not. Like that first example, I think the ambulance rider, or excuse me, the ambulance copay was $255, but we were still able to do $200. So covering a good portion of it for most Medicare Advantage plans. And if they want the higher amounts, we can go up here. And again, it's going to be simplified issue for those higher amounts. But we've really seen people stay under these guaranteed issue thresholds. It dramatically shortens the application process because there's no health questions. And then also the agent doesn't have to ask those invasive health questions if they're enrolling in a core medical plan that doesn't have underwriting. So we're real excited for these GI benefits, and really a differentiator since we do offer these all issue ages 0 to 90. But here's how the product works. You start with the base benefits, so daily benefits ranging from $50 to $1,000 a day. Just remember those GI thresholds. Then several different benefit periods that you can choose: 3, 6, 10, 21, 180, 365. There is a 60-day reset for those benefit periods. So if they're out of the hospital for 60 days, those benefit periods do reset. Also built into the policy is an observation benefit. Like during COVID, for example, we saw a lot of hospitals get full. They didn't have enough rooms, and so they were just kind of holding people there, and they were getting billed as observation. With Surebridge's plan, it would have paid the same as if they were actually hospitalized and were billed for a room. So as long as you hit that 12-hour mark, you get the same benefit as if you were actually confined. And then also, we've seen a rise in mental nervous disorders in the United States as well. And so built in the plan is a mental nervous benefit that pays up to $250 a day for a maximum 7 days per year for confinement due to a mental nervous disorder. So some real great benefits with the base policy. And once you select the daily benefit and benefit period, now is to add the riders. And so some of these riders are more applicable for the under 65 market. For example, the lump sum hospital confinement rider, we see that being sold in conjunction with the ACA plan. So you have a high deductible, maybe you lower the daily benefit with the HospitalWise and do like a $3,000 lump sum confinement. That way it takes a bigger chunk out of that deductible. But that's one to consider. Outpatient surgery rider just pays that benefit for outpatient surgery. That's going to be, resulting from sickness or injury. So that's going to be a popular rider in both the under 65 and over 65 market. Skilled nursing facility rider pays that benefit. A lot of the Medicare Advantage plans, cover days 1 through 20, and then they have the co-pays day 21 through 100. So we can dial in that daily benefit and also that benefit period, which is nice with this plan. Emergency care rider, this is going to be one of our more popular riders. The reason for it is it covers them for both sickness or injury, and it's not contingent on hospitalization. So if you're at home, cut your finger, you do have to go to an emergency room tied to a hospital, but you don't have to be hospitalized. So you cut your finger, you go to the ER, get some stitches, you would receive that benefit. Ambulance rider pays that benefit for a trip in the ambulance, and the outpatient major diagnostic rider pays those benefits for any of the exams listed there. So those are the riders, and again, a lot of different benefit options there. Remember that first screen there, or that previous slide that showed the GI thresholds. Remember, if one benefit is over the GI threshold, then it does go into simplified underwriting. So keep that in mind when you're applying for the benefits. Just up there again, I just put them up there again for you, the guaranteed issue thresholds, and I'll show you where you can actually find those in the quoting tool, but just like to reiterate those both before and after we go through all those benefits. Up on the screen here is state availability. If the state is blue, that means that the GI benefits are available. If the state is pink, that means that the HospitalWise is available, but only on a simplified issue basis. And if it's gray, there's no product available. So wide footprint with the guaranteed issue benefits. If you're in DC, Illinois, or Virginia, HospitalWise is approved, but only on a simplified issue basis. So keep that in mind when you're talking to your clients. We get a lot of questions on the pre-X with this plan since they're guaranteed issue. Just remember there's a 6-month look. So, you have cancer, getting treated for cancer, you're eligible for the GI benefits, and 6 months after the policy is issued, you'd be eligible to receive benefits for that pre-existing condition. Okay. So 6-month look back for the first 6 months of the plan. After that, they're going to be any condition. So that's how the pre-X works. So excited that we have those for both simplified issue and also for the guaranteed issue benefits. If you go into the simplified issue benefits, up here on the screen is the knockouts. You can see there's a look back period and what it's covered. So this is basically the questions that would be on the application if you did go into that simplified underwriting. If they have any of these, my suggestion would be to stick with the GI limits and under the GI thresholds, and then they should be good to go. Also in our plan, we have what's called a HospitalWise Senior Plan Builder. If you're familiar with like CSG actuarial, it's similar to that. However, what ours does is that you pulls up the Medicare Advantage plan and then actually customizes the HospitalWise quote. And so I pulled up United Healthcare, and you can see that it lists the copays on the left, the recommended HospitalWise, and then it'll pull up those benefits. Now, the plan does not have like a guaranteed issue check mark that you can check it and keep it under the threshold. So if you wanted this to be GI, you'd have to come in here and manually change like the daily benefit and the ambulance rider, get those below the thresholds. And you say, well, Seth, I don't remember what the thresholds are. We actually list them right here in the quoting system. And so right there above where you change those benefits, you're going to see this. And so you can remember what those guaranteed issue thresholds are. And adjust them accordingly. So real great tool with that HospitalWise Senior Plan Builder, makes it easy to customize those plans. Now, the last product that I'm going to talk about is our critical illness product. I'm very passionate about critical illness. It was actually the very first plan I purchased when I got into the insurance industry. I still use that, or I still have that critical illness plan because I see the value in it. Also, like most people, if you ask them, who do you know that's been diagnosed with critical illness, had a cancer, heart attack, or stroke? Usually someone close to them, right? My dad suffered from a heart attack. My grandpa passed away from cancer, and I saw firsthand in both those instances not only the health toll that it took on them, but also the emotional and financial toll. And so having some extra money there from a critical illness policy makes a lot of sense. And it's a plan that I believe you should be selling in both the under 65 and over 65 market. In the over 65 market, this was an article from last year. It just said that Medicare Part D beneficiaries with subsidies are nearly twice as likely to fill a prescription for high-priced medicine for cancer. Nearly 3 out of 4 Medicare beneficiaries do not qualify for subsidies because their income is too high, and 30% of cancer drugs were not filled. That's sad, right? So we got people being diagnosed with cancer, but the medicine is too expensive, and so they're not getting a doctor due to the cost. And I mean, I think that's a real problem, and we can come in with a solution for them with the critical illness. Up here is just kind of out-of-pocket costs for Part D enrollees for selected cancer medications that can exceed $8,000, with most of the spending above the catastrophic threshold. So it's just something to keep in mind. Excuse me, when you're talking to your clients, is that hopefully you don't get cancer, but you are going to have some exposure for most of your senior products. So definitely establishing a need here for critical illness. And the odds, I can throw up some stats all day, but we all know that someone's been diagnosed with these things, and it's going to happen to someone we know. And so definitely want to be having these conversations with them at some point. So nuts and bolts of the plan: issue age is 0 to 90. So again, great for that under 65 market to help cover deductibles and co-insurance, but also great in that over 65 market, kind of positioning it to cover travel. Maybe if you have to go to see someone that's out of network, or the costly cancer medications. This plan has issue ages 5,000 to 100,000. The maximum that someone can apply for if they're 64 or older is going to be 50,000, but there is no age-based reduction. So if you get 100,000 at age 60, you get to keep it after you turn 64. But if you apply at 65, the most you can get is 50,000. This does have a guaranteed issue plan, but it's only for issue ages 0 to 63. But if you apply for 5,000 or 10,000, there's no health questions if you're in the ages of 0 to 63. The thing that I will say is it only pays upon first diagnosis of a covered condition. And so if you've been diagnosed with cancer prior to purchasing this plan, it will not pay for cancer. It'll pay for all the other covered conditions, but that would not be a first diagnosis, and so that would not be eligible. In the over 65 market, it will be simplified underwriting. So again, true, accept, reject, no MMEs, no script checks, no personal phone interview. I know you might have some concerns with that, but I'll talk about the ability to carve out conditions, which is real handy in the senior market. Other than that, pretty straightforward. This also has that one-time application fee of $20, but remember, if you're enrolling them in both the HospitalWise and critical illness, it would only be one app. It's only one app fee. But the way our plan starts is you start with the base policy. Typically, people start with the cancer portion. That's just because the way that our software is set up. But then you can add a heart and a critical condition rider. So if you want a comprehensive critical illness plan, you start with the cancer, you add the heart, you add the critical condition. The reason we designed this plan this way instead of just adding them all is that, one, we wanted multiple payouts. So remember, you can receive the benefit for cancer, you can receive the benefit for heart, you can receive the benefit for critical condition. But also we wanted the ability to carve out conditions. So if somebody has already been diagnosed with cancer, they wouldn't be eligible for a lot of critical illness plans. But with ours, you can just, carve out the cancer and just sell them the heart, and at least they would have some heart protection. Actually, if they had cancer, they wouldn't be eligible for the critical condition rider either. I'll show you what's available for depending on the condition. But really having that flexibility of carving out a condition is huge in the senior market, because a lot of times they have a health condition, which would normally knock them out for critical illness. Here we can get them something which is better than nothing. And so I'll show you after that. We can do a la carte, where if you only want to sell cancer, you can, or you can add the cancer, heart, and critical condition to get all three coverage. Remember, you receive the benefit in each category if you add all three categories. So you can see what's covered by heart, you can see what's covered by cancer, and you can see what's covered by critical condition rider. If there's a lower percentage, like the coronary artery bypass, which is only covered at 25%, they still are eligible for the other 75%. Otherwise, pretty straightforward. I do like to point out, especially in the senior market, we do pay 25% of the benefit for loss of independent living, unable to do 2 out of 6 ADLs. So nice benefit there that they can get a portion of that if they, are unable to do 2 out of 6 ADLs. So real competitive as far as the conditions are concerned, but keep in mind that you are eligible to receive the benefit once in each category. Here's just an example in the over 65 market. What we see a lot of times is, lower benefit amounts. So we did 20,000 here. Critical illness does get pricey. The good news is we can go all the way down to 5,000 if they want. But just kind of give you an idea of how to position it. And remember, like, you can talk about the out-of-pocket, maximum out-of-pocket with the Med Advantage plans. You can talk about travel, meaning travel to go see the specialist that you want to. And then also that prescription coverage, that cancer drug coverage should be worth a conversation as well. Up on the screen here, CA stands for cancer, HS hospital, CCR, critical condition rider. You can see there's a check mark. That means they're not eligible for that condition. But like COPD, I can't get the critical condition rider, but I could get the cancer in the heart. And so in that senior market, when they have some issues, remember, you can carve it out. So if they have uncontrolled diabetes, they can still get the cancer. They just can't get the heart or the critical condition rider. So pretty cool that we have that ability to carve out conditions, especially in that senior market where they might have some health issues. So my tip number one is educate them on the out-of-pocket costs, right? I said earlier, a mistake I see with a lot of senior clients is they only talk about the premium, right? They enroll them in a Medicare Advantage plan, they talk about all the premium savings, but they don't educate them on the out-of-pocket costs, and you need to be doing that. You can go out into, a summary of coverage in the Medicare Advantage plans, and all the out-of-pocket costs are outlined, right? It's going to have a place for a maximum out-of-pocket amount, right? So that's what they're going to be responsible for. It's going to talk about co-pays for inpatient hospital. It's going to talk about co-pays for emergency care. It's going to talk about co-pays for major diagnostic exams. It's going to talk about co-pays for the nursing home. It's going to talk about co-pays for the ambulance. It's going to talk about co-pays for chemotherapy, right? 20% coinsurance on this. And and for catastrophic coverage for your stage 4 drugs. So if you go out there and you go to the summary of benefits of the Medicare Advantage plans, you need to be having that conversation about how they're going to pay for those out-of-pocket costs. A lot of times people don't go out there and show them, but in the policy itself, it says, hey, this is what your responsibility is. You just make sure that the client acknowledges them, and then talk to them about, hey, are you going to pay for them out of pocket, or do you want to look at paying for them, utilizing insurance? And a lot of times they'll say, oh, well, let's look at insurance. And so that's an easy way to lead into it. Tip number 2, I always say avoid single option aversion. There's a book, it's called The Science of Selling, and he talks about study that was done about with selling DVD players, right? And again, long time ago, DVD players, but basically in scenarios where they only offered one DVD player, only 30% of the people that looked at them purchased one. But when they offered 2 DVD players, 30% purchased the first one, 30% purchased the second one. And it's not the fact that, the percentages that purchased it, it's the fact that 60% of the people purchase a DVD player. And so by showing multiple options, it increases the likelihood that the client chooses one of them, because they're going to choose the one that makes the most sense to them. And the good news is that Surebridge makes this really easy for you, because in our software we allow you to do kind of a good, better, best scenario. And so in this scenario, we did a real basic senior HospitalWise. So we just did the base benefit, $350 a day for 6 days, and we did the skilled nursing facility riders, $200 a day for 21 through 100. So gave them an option for $36 a day, right? Very affordable. Quote 2, we did the same thing, but we actually added, ambulance rider, emergency care rider, major diagnostic rider, skilled nursing rider. We did keep this so that was about $48 a month, and then we also added critical illness at $26.40, and so we did looks like I did a $10,000 critical illness. So this one, HospitalWise, with more benefits on the HospitalWise and critical illness. And then the last one, we actually maxed out some of the HospitalWise benefits, so we bumped it up to $400 a day. We increased the ambulance transport rider, and we also, I think, we increased the critical illness up to $1,500. So this one was $100 a month for that. But what this does is they're going to choose the one that makes the most sense, right? If you just show the high one, they probably might say no, but now if they have something to compare it to, they're more likely to purchase one of them. So I like our software because you can do a good, better, best scenario with them, and hopefully they'll choose one of them. My last tip is just, agents think that clients aren't willing to pay for an additional premium, right? They're like, they just want that low cost Medicare Advantage plans, and they don't want any additional benefit, or any additional coverage, because they don't want to pay premium. In my opinion, that's a limited mindset. A lot of times you're going to have some premium savings from going like Part A, Part B with the G to a Medicare Advantage plan. And so you can leverage some of those savings. And then also those Medicare Advantage plans a lot of times have additional benefits, right? Maybe they have dental benefits, so you're freeing up some premium there. Or that Medicare Advantage plan has vision benefits, so you're freeing up premiums there, or hearing benefits, or over-the-counter benefits, or any additional benefits that Medicare Advantage plans. Make sure you're pointing them out, because that's some additional savings you created them that might be able to be put towards an ancillary product like HospitalWise or critical illness. So I always like to point that out, because one of the biggest objections I get from agents, not from clients, is that, oh, they don't want to pay for it. But again, I think that's really some limited mindset. So with that, Sandy wanted me to jump into the actual point of sale tool. So hopefully you can see my screen here. Our agent portal is suppsportal.com. So suppsportal.com. That is the website you want to go to. If you have anything else bookmarked with Surebridge, delete it and just create suppsportal.com. If you're going to the training site, you probably have something bookmarked wrong. So just bookmark suppsportal.com, go directly there, log in. You'll be able to access everything from that. That's the only bookmark I recommend, or only web address I recommend bookmarking, because it's easy to get to where you need to go. But once in here, I can click on Surebridge Quote and Apply, and it's going to pull up the quoting tool here. I can click Build a Proposal, put in a zip code, and an email address, last name, first name, birthday, and that's all you need to enter. I can click on Save and Continue. And click on Add Plans. This is where I can do a good, better, best scenario. So I'll click on Add Plans. Here's the HospitalWise Senior Plan Builder that I mentioned. So if I load this, you can see there now I have my 2023 plan years. I need to update my slide there. Select United Healthcare, PPO plan, click View. Here's the copays. Here's the recommendations. Click Update Selected Plans. Click OK. Jump back over here. And then on the Illness tab, it auto-filled those. And so if I like those, I can click on Requote. I'm going to add that to quote 3. Now, some of these benefits made it so that it wouldn't be simplified issue. Right there are the, or it wouldn't be guaranteed issue. Right there are the GI thresholds. So I'll flip that to 200, and then I should be good there. So I'm going to do Requote. I'm going to add that to quote 2. Then I'm just going to go do the basics. So I'm going to take off all these riders and just do the skilled nursing rider and the base policy. I'll add that to quote 1. And I can scroll up here, and here's the critical illness. Click on options. I'm going to lower that to 5,000. For all 3 benefits. I'll just add that to quote 2. So I click over on done, and there are my 3 options that I'd show my client, right? Maybe I would add critical illness to that last one. I just wanted to give you an example of what it looks like. From here, if I wanted to jump in the application, I could. I'd hit select, and I'm off to the races. If I wanted to email it to them for them to review, I could do that there as well. So, Sandy, with that, that's what I had prepared for today. My contact information's up on the screen there. Otherwise, reach out to the great folks at Western Marketing, and they can answer your questions as well.
Thank you very much, Seth. I appreciate it. Everyone, this is a very great opportunity for you guys to take advantage of this guarantee issue product, unlike any other product in the market. So it's a unique product that you can utilize as much as you can. There are way too much opportunities to leave behind, especially on this still this enrollment period of January to March. So please take advantage of that. I will be sending some information to you guys, a copy of the webinar, some information on the state availability and and also the information on how to get contracted as well. With that, if anyone has any questions, please send me a text or send me an email, and we'll answer those questions. I want to thank Seth Growth. I wanted to apologize for some of the hiccups on the technology today. Apparently, we had some lagging on the way the system was operating, so we couldn't have a good introduction to Seth, which is the National Director of Sales for Surebridge and United Healthcare as well. So thank you very much, and you guys have a wonderful day. Thank you, Seth.
Thanks.
Have a good one.